All right, so we're rolling. All right, so Rachel, thank you for coming in and taking time out of your busy day to participate in this mock session that we're going to do. It should take about 50 minutes to an hour, give or take some. We also have an assessment following that. How do you feel about everything so far?
Good.
Okay, great. Now, as part of the informed consent process, it is my duty as a clinician in training to inform you that everything that you share in this session is going to be kept confidential between you and I. I am under the supervision of my professor, so I will be discussing some of what we talk about in our session with my professor, but outside of that, everything that you share is going to be kept in confidence. Now, there is a couple of exceptions to that rule. And the first and foremost is that if you present yourself to be a danger to yourself or others, then I am required by law, mandated by law, to report it to the necessary authorities. Also, if there is any evidence or suspicion of elder abuse or child abuse, I'm also mandated under that same requirement to break confidentiality. How do you feel about that?
Makes sense.
Okay. All right. So go ahead and get started and making sure it's rolling. Okay. All right. So what brings you in today?
Well, I've been having these, I don't know, I guess you call them flashbacks,
Mm-hmm.
from my time on deployment, and I'm worried that I might have PTSD, so that's why I'm here.
Mm-hmm. You having flashbacks. How long were you in the military?
4 years.
Okay. I'll also be taking some notes throughout the session just to make sure that I have everything that you said accurately. So hopefully it's not going to be that much of a distraction. You're okay with me taking notes. So you were deployed for 5 years?
Well, I was in the military for 4 years, but total I was probably deployed for a year out of those 4 years, so
Mm-hmm.
I've been out since February.
Mm-hmm.
I didn't really feel like I had any issues. The past couple months, I would say it's suddenly been coming up. So I don't know what
Mm-hmm.
that means, but that's what I'm here to figure out.
Okay, so you were in the military. You've been in the military for 4 years. You've been deployed for 3 years. Where were
One
you?
year out of
One
those
year.
4 years, yeah.
Sorry. Where were you deployed?
I was in Iraq mostly.
Mm-hmm.
Um, yeah, mostly Iraq. I went to the border of Afghanistan in Kuwait, but that was it. We
Okay.
were just kind of patrolling the border.
And what was that experience like for you?
Um, I mean, it was chaotic. I was the only medic available to go on the line, and I
Mm-hmm.
was also the only female in my company. So I mean, that part didn't bother me as much. I was exhausted. I was the only person. There was no one to relieve me. I was always on mission, and it was exhausting. It was rough. But I mean, I made it through. I thought I
Mm-hmm.
made it through all right, but
Mm-hmm.
now I'm just kind of
Sounds overwhelming. You were the only female there, only female medical person there
yeah.
working.
Yeah, that part, like, I definitely had to prove myself at first. Oh, you're good.
Sorry.
No, you're good.
Mm-hmm.
Yeah, I definitely had to prove myself, but once I got over that phase, it was all right. It was just, I was worked to death. I was
Mm-hmm.
exhausted all the time.
What were your hours like?
Oh, 24/7.
24.
Yeah, I got little naps here and there, but there's no off time, there's no nothing. It's
Mm-hmm.
just going, going,
So
going.
you're working 24/7, no
Mm-hmm.
off time.
Nope.
Wow. How did you get any sleep?
From traveling from here to there, I'd sleep, and I
Mm-hmm.
never had to drive because I was the only medic, so I never had any. Besides, like the rare occasion where I had to sit in the gunner's hatch and check things out, I was
Mm-hmm.
never on a duty per se, so I could get naps here and there usually.
Mm-hmm.
Um, but yeah, otherwise I was always on. And of course, if anything happened, I'd be woken up and have to go tend to someone or whatever, which always seems to happen, right? The moment you get a chance to sit down, you got to go and do something
You're
else.
busy.
But yeah,
So you mentioned flashbacks. How long have you noticed that you've been experiencing those flashbacks?
probably at least the last month, if not the last 2 months.
Okay. So 1 to 2 months that you've noticed it.
Yeah, at first it was just nightmares. Like I'd wake up and realize I was dreaming.
Mm-hmm.
And that's probably been going on for 2 months, which is why I say that. But like in the last month, it's
Mm-hmm.
been, I'm walking, from one class to another, and I turn a corner and I see a casualty on the ground, and I like have to blink, and then he's gone, and I'm realizing like, wow, I'm seeing things. Like, what is going on here? So that's what's really bothering me. Like, I feel like the nightmares or whatever, that's kind
Mm-hmm.
of, you know, I feel like that's normal, but seeing things while I'm awake is not okay.
So you feel like the flashbacks are more distressing for you because you experience it like throughout your day and it's getting in the way
Yeah,
for you.
yeah, definitely like when I get a flashback, like either a noise will sometimes set off a memory, and
Mm-hmm.
I go in full panic mode. I just start breathing really fast and my heart's going fast, and like, it takes a long time to calm down from that, and then I'm distracted and I can't focus, and it's the nightmares or whatever. I wake up, I'm
Mm-hmm.
like, okay, calm myself down, go back to sleep. But like during the day, it's just I have one flashback in the morning, my whole day's shot.
How long would you say the flashback itself lasts?
Sometimes it's the blink of an eye, like I see
Okay.
something out of the corner of my eye and I look and it's gone.
Mm-hmm.
And sometimes, usually noises I feel bring back more memories.
Okay.
Um, so when I hear a noise that reminds me of something, like a car backfiring, or the other
Mm-hmm.
day a transformer, those big electrical boxes
Mm-hmm.
blew, and that really set me off. Like I hit the ground, I was all of a sudden I was back, and it lasted. I mean, I don't know. I felt like it lasted forever, but it was probably only 30 seconds to a minute, maybe. I don't know.
Mm-hmm.
It's hard to tell because you know, and that's the weird thing too. When I was deployed, I didn't feel like I was always in such a panic mode. But now that these memories are coming back, I'm having these sensations that I don't recall ever having.
Mm-hmm.
But I guess in the moment you don't always remember.
Okay.
But yeah, it's very, very strange, and I don't like it because I'm trying to through school, I'm trying to get my degree, and I can't
What
when I get
year
this
of school are
distracted.
you in now?
So I'm a student at Alliant working on my psychology degree.
Mm-hmm.
Um, I'm really excited. I like studying that kind of stuff. Um, but I mean, I'm feel like I'm so messed up right now. How can I figure this out and help someone else?
Okay, so you just started studying your degree
Hmm.
for your doctorate, become a doctor.
Hmm.
Okay. But you have these flashbacks that seem to be getting in the way. And it's getting in the way of your functioning, daily functioning.
Yeah, I feel like one flashback and my whole day is just gone because I can't focus. I
Mm-hmm.
can't get away from it. And
How many flashbacks would you say you have in a week?
in a week,
Mm-hmm.
two, maybe three. Um,
2 to 3 per
hmm
week. And is anyone else around you when you experience these flashbacks? And what is it like?
Not all the time.
Okay.
Um, a lot of the times I'll just laugh it off, like, aha, veteran moment, like laugh it off. But
Mm-hmm.
inside I'm freaking out.
Mm-hmm.
Because I don't want anyone to worry,
Mm-hmm.
Yeah,
Well,
so.
wow, it seems very admirable of you that you spent that much time in the military deployed, and you actually got exposed to these very traumatic events in Afghanistan. And now that you are a civilian, you're trying to transition back to civilian life, that it seems that these flashbacks just aren't sitting well with you, and you're not able to kind of move forward. And how is it impacting your school?
I mean, if I have a flashback in the morning on the way to class, I can't. That class, I might as well not be in it because I can't focus at all. I can't pay attention to what the professor's saying. I can't engage in any kind of conversation or debate or anything.
Mm-hmm.
It's like I just sit there like a nothing, like I'm nothing, and I'm just spacing out, and I can't. I don't know. It's just like I can't break away from what I just saw and what I just felt to come back and be in the moment. It's like I'm
Mm-hmm.
somewhere else in my memory.
Hmm.
Yeah. So
Must be very overwhelming. It sounds overwhelming for you.
that's exact the word, overwhelming. I'm just completely overwhelmed at that point.
Yeah.
And and it's just weird because I mean, I felt like I was okay, and I can think back and joke with some of my friends about what happened and what we did, and but then I see these things and I'm just freaking out, and I don't get it.
Mm-hmm. And what would you like to see in therapy happen?
I mean, I definitely like to. I feel like a lot of my anxiety about it is that I don't understand why it's happening. I don't know why I'm seeing these things. And I guess maybe there's something I need to work through to figure out why I'm having these flashbacks. But
Mm-hmm. I would say that from what you've described so far and what we've seen in our practice and history, that it's pretty common that veterans, when they leave the military, they have PTSD. They have these issues with flashbacks and unwanted thoughts kind of popping up in their mind and having nightmares as a result of the traumatic experience that they experienced, that they went through when they were in the military. Um, it's I guess you can understand it as the mind's way of coping with that trauma that you're exposed to. And I know it's very difficult that you have to kind of try to manage, these intrusive thoughts that are popping up and it's causing you to seem to engage in bizarre behavior in front of everyone else at your school. Meanwhile, you're trying to work towards a doctorate degree, which is very admirable. I think that, you go from the military and we appreciate your service and everything. 'Cause I know that's a lot of hard work for you to do that, to commit so much time of your life to serving our country. So I personally thank you for doing that. And I just find it amazing that, you go from that to wanting to pursue a doctorate degree. It's pretty amazing.
thanks.
So, outside of the flashbacks, have you noticed any other symptoms that have been problematic for you?
Just the kind of like, I wouldn't call it an out of body experience, but after I have the flashback and I get all worked up, I
Mm-hmm.
just disconnect and I'm just like a space cadet the rest of the day, and I can't engage, I can't focus, and that's what's really bothering me. I mean, the freaking out feeling like I have a heart attack is not fun either,
Mm-hmm.
but it completely ruins anything I wanted to get done that day. I'm completely unproductive because I'm just not here. I'm just like, ooh, I don't even know how to describe it, but I wouldn't
Mm-hmm.
call it an out of body experience, but it's definitely like some kind of, I'm not really here.
Yeah.
The lights are on, but no one's home.
Yeah.
So
It must feel very weird.
it is very weird because it's like, it's weird because I know I don't want to feel this way,
Mm-hmm.
but it's almost like I have to in order to calm down, in order to pretend like it didn't happen, like I didn't see that, and pretend like it's okay.
Mm-hmm.
I feel like, yeah, I feel like I don't want to feel that way and I don't want to act like that, but I can't help it. In the moment, I just can't think of anything else to do.
Mm-hmm.
And so that's what's frustrating because I'll think back on it and be like, man, what a waste of a day,
Yeah.
so
You wish that you could manage those
yeah.
flashbacks that keep popping up. What is your social life like outside of
Um,
school?
I have a few friends that I'm lucky enough to get to see a lot because we all live pretty close.
Mm-hmm.
I always make sure to take at least one day a week where I'm just hanging out and not worrying about school or worrying about other things. And
Yeah.
um, so, yeah, I don't know. I'd say it's pretty healthy.
Has it happened? Have these flashbacks happened when you were with your friends?
Yes, I would say maybe once I saw something out of the corner of my eye, but I was kind of able to bring myself back really quickly because we were in the middle of a conversation and I just kind of kept going with it and pretending like I didn't see anything, and no
Hmm.
one really noticed anything. No one pointed out anything, and I was able to continue. Usually, when I see things here or there, I'm able to come back from it a little better. But when I
Mm-hmm.
have a full on, like, I'm back in it, that's when I'm just wrecked.
Hmm.
And those happen less often than just seeing things here and there.
Interesting. So I wonder how is it different that you are able to kind of manage those flashbacks when you're around your friends, right? Outside of school, but when you're in school, it seems to be much more pressure on you, and
Hmm.
it seems that maybe you can't. you have difficulty regulating those flashbacks and regulating what's happening in your body and your mind at that time when you hear the loud noises that triggers that response, the traumatic response.
Yeah, maybe. I didn't think of it that way, but yeah, I feel like when I'm just on my own trying to get stuff done,
Mm-hmm.
that's when they're worse, I guess. Or they don't come more often. I would say they're just worse. Or if I hear something that sets something off. But usually,
Mm-hmm.
if I'm around people, I don't want them to see that, so I kind of like have to calm myself down. It's different. I feel like there's more pressure to not completely lose it. I don't know.
Oh,
It's
I
weird.
see. That's a good, I guess, coping skill that you've actually utilized when you are around other people, that you are able to regulate that response a little bit better. But when maybe you're by yourself, it kind of just takes a different form of its own.
Yeah, I feel like it kind of just goes out of control when no one's around to. 'Cause I don't know.
Yeah, interesting. Okay. And outside of the flashbacks, have you had any other problems, emotional problems, any psychiatric problems in the past outside of this experience that you're having now?
No, I've never been diagnosed with anything, so I've
Okay.
never really had any complaints until now.
When was your last medical visit to the doctor?
It was right when I left, so like 9 months ago.
Okay. And how did that come out? What was the outcome of your your med evaluation?
They had a concern because I had developed migraines. Sure, from sleep deprivation, but
Mm-hmm.
yeah, they marked a concern for migraine headaches because they couldn't really find a cause. There wasn't like a clear cause.
Mm-hmm.
Um, and then other than that, I had a wrist injury. Nothing major, just little things here and there. But
Mm-hmm.
and another big one was the migraine headaches.
For the migraines, did they prescribe you any medication?
I mean, I really didn't want any, so they just suggested like, well, if it gets really bad, to take over the counter medications.
Mm-hmm.
Um, so I've just been doing that when they come up. They're fairly manageable. They just come so often now. And I don't know if that's related or what, but
I mean, what medication, over the counter medication, are you taking for the migraines?
Excedrin.
Excedrin. How often do you take it?
Um, well, nowadays I get migraines like 3 times a week, so 3 times a week.
Mm-hmm. And does
Usually
it
one dose
usually?
will do it.
Okay.
Sometimes, like after an hour or so, if it still hasn't gone away, I got to do another dose. But
Mm-hmm.
1 or 2 doses, I'm usually able to just go in a dark room and sleep it off. But
Did you notice the migraines when you were deployed?
um, I noticed them when if we came back from a mission and I got to, like rest a little bit easier because we were in actual like beds and stuff. And
Mm-hmm.
I would wake up with a migraine almost every time that we were on a break.
Mm-hmm.
But while on mission, I didn't really notice anything.
Mm-hmm.
It was only ever when we came from a break.
Okay. Um, so outside of just trying to get a clear picture of, what you're experiencing, if there are there's any other psychological issues that may be an issue. I mean, I know you mentioned that you have flashbacks, you have difficulty concentrating. How is your sleep?
Oh my gosh, sleep's terrible.
Yeah. How many
um,
hours do you get per night?
if I'm lucky, I'll get 4 solid hours, and then the rest is waking up and
Mm-hmm.
kind of barely going back to sleep, and then waking up again. And yeah, usually It takes a while to fall asleep, but once I do, I'm down for at least 4 hours, and then I just
Mm-hmm.
wake up and constantly wake up, go to sleep, wake up, go to sleep until it's time to get up. So,
Mm-hmm. How many hours of sleep would you like to get?
I'd love to get 6 to 8 hours. That'd be wonderful.
Okay, I can imagine that that's very difficult for you, that you're not able to get your full night's rest that you would like to get, and then you have to get up and you go to school. You're in school full time. So I know that is a lot of pressure
Yeah,
on you.
and I don't know if that's making things worse because especially when I'm really tired, I feel like the flashbacks are even worse as if I don't have the energy to contain them.
Mm-hmm.
And then of course, those flashbacks give me nightmares, and then it's just a vicious cycle. And I feel exhausted all the time.
Yeah. I'm glad you came in today
Me too.
to kind of get your mind wrapped around this and see what's really going on and get some help.
Yeah.
And I'm here to work with you, through this issue, this problem that seems to be pretty heavy and weighing down on you.
Yeah,
pretty
definitely.
badly. Okay. So can you tell me a little bit about your family history in terms of your upbringing?
Well, I'm actually a foster kid. I was in I don't really remember because I was so little, but I went into a foster home with a couple other kids, and then they ended up adopting all of us.
Mm-hmm.
So I've kind of had the same, even though I'm a foster kid, I kind of had the same family my whole life. I
Mm-hmm.
wasn't like, the other kids that get tossed around and stuff. And
At what age did you enter the foster care system?
I was surrendered when I was born.
When you were born.
Yeah,
Okay.
I have no idea who my biological parents are.
Mm-hmm.
I just didn't really care to find out. But my adoptive parents are wonderful, and
Mm-hmm.
like I said, they adopted. I have 4 siblings, so all 5 of us.
Mm-hmm.
And they're great. They're just the best.
Yeah, that's great. And
Yeah.
you've been with that one family since you were born?
Mm-hmm.
Okay.
Yeah, I got officially adopted when I was 5.
Mm-hmm.
So, I mean, they're the only family I've ever known. I just thought it was normal,
Yeah. Do you keep in contact with them often?
Yeah. Definitely my dad. He loves to check in all the time, and my mom keeps herself super busy.
Okay.
A lot of us, I mean, we're all pretty much, I think there's, my youngest sibling's in high school, so we're almost all out of the house.
Oh, wow.
Yeah. She's a senior in high school, so.
Oh.
Yep. So we're all almost out of the house, and so she tries to keep herself busy because otherwise she'll lose her mind. She loves us a lot.
What do you think about you going to school and working towards your doctorate degree?
They're so proud. Neither of them ever got a college degree.
Mm-hmm.
So none of my siblings really. I know, like 2 of them are in college. One of them went to technical school. He's a mechanic for some high end mechanic, like for I don't know, Ferrari, all those fancy cars, and
Yeah.
but yeah, I mean, my other siblings don't really know what they want to do, and I've always known what I wanted to do.
Mm-hmm. Are you the oldest?
No, I'm the second oldest.
Okay.
So.
Wow.
Mm-hmm.
So they have someone to look up to.
Yeah, they're great. We've always been really close. And when we were younger, of course, we fought like cats and dogs, but now it's great. I have a really good relationship with all of them.
Mm-hmm.
Yeah, I think we're all just really grateful to have ended up in such a good family because you hear these horrible stories about the foster system and stuff, and I think we just all feel really lucky.
Yeah, you're very fortunate that you ended up with a great family that's very supportive of you.
Yeah, and even because the younger one, well, my sister who's next youngest from me, she developed schizophrenia, and when we were, I mean, it was when I was a little bit older. I was already in college and took some time off, came home to help out and stuff, and I think she was 16 or 17 when it started, so that was kind of hard. But I mean, honestly, like with all the support, I feel like she's doing great. Like, we really came together as a family. It was no questions asked. Like we were there for her, and she's been doing really well. So.
Have you told anyone about your experience with the flashbacks yet?
No, nope.
Okay.
I do not want to worry anyone about it, and hoping I can get it under control. And
Yeah.
I just really don't want to worry them. I know they would support me. I just, they look up to me a lot, and especially my younger siblings, and I just don't, you know. And I know my dad would worry. Oh my gosh, he would take off work, and my mom would freak out, and I don't want to cause all that.
Yeah, but they seem to be very supportive of you outside of, you're thinking that they may not be supportive in terms of the flashbacks, but outside of that, it seems like they've been pretty supportive of you up until now. So, but you don't want to share.
Well, I'm just worried they'll be over supportive.
Okay.
And I don't want to worry them. They work so hard and they do so much for us, and I feel like once I can kind of get a better understanding of what's going on and I don't know, get a better grip on it, then maybe I could talk to them about it. It's just for now when I'm not really understanding what's happening, it's too much to put on them. I feel.
Yeah.
I mean, I know they wouldn't care and they'd be so, happy to be there for me, but I really don't want to worry them.
You don't want to be a burden to
Yeah,
them.
exactly.
Okay. All right. Well, again, like I said, I welcome you to share. This is an open space for you to feel comfortable enough to be able to share what's on your mind, what you're feeling, and everything. Um, as part of this intake, I have a few more questions that I do want to ask to get more of a well-rounded picture of you as a person. And following, I do have an assessment that I want to give you. It's a cognitive assessment. So, how are you feeling right now?
Good. I feel like I've already told you what's going on, and you have a good idea of what's happening, so I'm excited.
Okay. I know you said that you just want to kind of be able to get a better hold of, be able to manage, these symptoms that you're experiencing with the flashback so that you're not kind of falling out in the middle of the floor at your school,
Yeah.
when you're trying to focus in class and that's a problem for you. You would rather be able to be present in class and focus on what the professor is saying.
Yeah.
Yeah. Okay. Well, that's the goal of treatment. We're going to try to get you to understand, help you to understand what's happening with you. And to do that, I do have to kind of do a more comprehensive assessment to get a better understanding of what's going on. And once we come to that understanding, then I'll be able to educate. We can do some psychoeducation. I can give you some more information about it. But from what you're saying so far, it does sound like it maps onto the diagnosis of PTSD. You have spent a considerable amount of time in the military, and you were deployed for a year in Afghanistan. You were exposed to quite a bit of trauma there. And like I said, from what we've seen in our clinical practice, that is pretty common with veterans who have exposed to that level of trauma. Um, and so another part of therapy is just working through the trauma, giving you the skills, the tools that you need to feel like you are capable of managing that, not only when you're by yourself, but when you are around other people. Because it seems that you have a handle of it to a certain extent when you are when you're by yourself. But when you're around other people, then it seems to be a little bit more challenging for you. So.
Yeah, I mean, I definitely have to put more effort into it. But I can kind of tone it down a little bit when I'm around people. It's when I'm alone that I feel like it gets away from me because I don't have anyone judging me, I guess. I don't know what it is about it being worse when I'm by my own.
Okay, so I'm sorry. I twisted. I got it mixed up. So when you are alone, it's much more difficult, or much more difficult for you to manage that when you're alone.
Yeah.
But when you're around other people, then you don't want to be judged. You don't want people to look at you that you're crazy or anything like that.
Yeah.
So that kind of helps you to be able to get through it, to kind of hide it.
Yeah.
But it's still problematic for you.
Oh, yeah, because I still have all the symptoms, but I'm putting a smile on, pretending like nothing's happening. And then when I'm alone, it's just really bad.
Yeah. Okay. How was it for you in school? You mentioned that you went to the military. Did you go into the military right after high school?
My parents wouldn't let me. They wanted me to at least try college first. So I got my undergraduate degree in psychology.
Oh.
Yeah, and then I joined because then they couldn't say no.
Yeah.
I knew I always wanted to join the military. They just didn't want me to, and I don't blame them. They were really worried about me while I was over there.
Oh, so you have a bachelor's in psychology. That's great. And then after you graduated, you went to the military, and you did 4 years in the military. Okay, so it's been 9 months since you've been out, and then 2 months since you've been experiencing these symptoms.
Yeah.
Okay. When you were in college, did you have any difficulties as far as getting through college?
Not really. I went to a local college, so I stayed at home. So I didn't really do the whole dorm thing, but I think that was for the better. I really enjoy learning stuff. I love learning new things. So I really like school, and I wasn't really into the whole partying part of it. So that part was fun a little bit, but some people took it a little too far.
Yeah.
So I was really glad I got to stay at home and also help with my younger sister. That worked out really well.
That's great. So what were your grades like in college?
Pretty average. I mean, was no, whatever they call the honors people.
Yeah.
But yeah, I mean, like 3.0, 3.2, something like that. I don't know.
That's great. Yeah. Still on a roll.
I love learning new things and doing stuff, so I get really distracted. I'm like, oh, what's this? And then kind of take on too much at once, and then, my grades are kind of like, I mean, I've never been like a straight A student or anything, but I do find myself like getting interested in so many different things at once.
Different things like what?
Like, I joined a whole bunch of clubs, and, I've always done volunteer work, and especially anything that I've never like heard of before or seen before, I want to know how to do it. So,
okay. What kind of clubs did you join?
I joined, I was in soccer and basketball and volleyball.
Wow, soccer, basketball, and volleyball.
Yeah. And then I did like the junior lawyers club, like we did, mock trials and all this kind of stuff. And we did juvenile court too. That was really cool. They give juveniles, when they're arrested, they give them the option to be tried by a student court. So we did that, and that was really cool. And yeah, and then I was in the theater class, and I was in I took dance classes, and I was, there was like a what do you call it? Like I guess it was kind of a jazz group. Lots of trumpets and piano and lots of fun stuff. Like everything. I was into everything.
That sounds very interesting. Like you seemed like you were pretty spread out in college. You got a chance to do, quite a bit.
Yeah, and a lot of it was like stuff I just didn't know what it was. So I was like, well, I'm gonna figure this out. And so wasn't good at everything, but I enjoyed learning different things. Like I just want to know how it works or how to do it, or
so you don't mind taking risks. Sounds like
no, not at all. Yeah. Which is a blessing and a curse, I guess.
Yeah. Okay. And what was the position that you were in the military? What's the name of it again? The position that your job position in the military.
I was a medic.
A medic. Okay. Interesting. So when you're in the military, you're a medic, but now it seems like you're kind of diverting away from medicine and you're more interested in psychology.
Yeah, the politics of medicine, it's a business to keep people sick, and I just can't. I don't see myself practicing medicine, but I do like to heal people. So I feel like psychology was the best way for me to go to do that. I just can't stand the politics of medicine.
Yeah. Okay.
I did enjoy my job. I can't see myself doing it as a career.
So what attracted you to psychology?
Well, when my sister was diagnosed, because at first I was an English major, and when my sister was diagnosed, none of us knew what the heck that meant, schizophrenia, her reactions to things. It was we were just all blindsided. And so, I guess I must get this from my dad, because he immediately like dropped everything and learned everything he could about schizophrenia and how we as a family need to not accommodate, but like help her and like our actions and reactions to things. And like he went all out, and so I did too, because that's just how we are, I guess. And just I learned about that, and then I got sidetracked, and I'm like, well, what is this, DID, what does that mean, and why does she have this diagnosis, not that one? And I just kind of, I think I read the DSM from 4 at the time, from cover to cover, and I was just like, I was sold, and I went straight to my administration's office and said, change me to psychology.
You followed your passion.
Yeah.
Awesome. Interesting. Okay, what would you say are some of your strengths? If you could name 3 or 4 strengths that you have, what are they?
I never give up, that's for sure. When I say I'm going to do something, I do it.
Mm-hmm.
Um, I guess I'm strong-willed. I can I love to help people. Um,
Those are great. Especially with you, like I said, I can't get around it, but the fact that you spent, 4 years in the military, that it's very commendable, I think. Yeah, that's a huge sacrifice that not too many people are willing to make. So again, I just have to keep thanking you for your service because it's just so admirable to me that that you did that, you committed that, and then, like you say, you didn't foresee having flashbacks as part of that experience, but it's something that kind of came with the territory, unfortunately.
yeah, yeah, and I always laughed about it too because my guys would joke about PTSD and stuff, and I'm like, well, if anyone's gonna get it, it's me because the studies show that medical personnel are more likely to have PTSD than other occupations in the military. So that was always my joke, and then here I am, cursed myself.
Hmm.
um,
It sounds like something similar to the field of psychology when you're working with clients. You have the vicarious trauma that you hear so many stories of clients and all their pain and trauma they're going through, and it's like sometimes it kind of carries over into the therapist, unfortunately, if the therapist isn't, aware of it and not taking care of themselves. So self-care is really, really important, even in this field, psychology.
yeah, and yeah, I think that's something that I lack is I like to do things for other people and learn new things, and I don't really
Yeah,
stop to take a step back and take care of my own needs.
yeah.
Um, yeah, I find that it's probably a weakness of mine.
It's very challenging, especially with a position, a job like you had in the military. It's 24/7. It's very demanding. It's like, how can you take care of yourself if you're so devoted to doing your job, you know?
Yeah, exactly. Yeah.
Wow.
And I just did not know how to say no. I was always doing everything, so.
Yeah. Glad you're still here. Still
Me
fighting. Still in the
too.
fight. Okay. Just want to go over my notes and make sure that I asked you what I need to ask you. Also, our meeting is going to probably take place over the course of maybe 3 or 4 sessions to kind of get a well-rounded picture because we have several tests. I already discussed with you prior to you coming in that we do have several assessments that we administer clients as part of the intake process. And it's just to kind of get a picture of their cognitive functioning, cognitive ability, emotional functioning. Um, so, how are you feeling about that and everything up until now so far?
Good, good. I think you explained it really well, and I feel like I know what's gonna happen. I think.
Okay. Do you have any questions for me
Mm,
at this moment?
no.
Okay. Um, so I know you mentioned that initially when we first started that you said that you had an idea that it was PTSD. Where did the idea come from?
Um. Well, when the little flashbacks came, I guess I'll call them little flashbacks. I kind of didn't think anything of it, and then my first real breakdown when I heard a loud noise. I think it was a big truck backing up or something, or
Mm-hmm.
backfiring. That's the word.
Mm-hmm.
And I had that big breakdown. I was like, I was worried at first that I had schizophrenia like my sister. And
Mm-hmm.
so I immediately did a bunch of research and like went through, the symptoms and everything. And that's why I kind of was like, well, maybe it's PTSD. And I read a little bit more on it. And I was like, well, I don't want to psych myself out thinking I have, like the people go on WebMD and decide they
Right.
have cancer. Like I don't want to be that guy. So, so that's why I was like, you know what? I need to put this in the hands of someone else who's more, qualified than I to figure this out and work with me to. So that's why I kind of think it's PTSD, but I don't want to be
Mm-hmm.
labeling myself. And
Right. Well, we also don't want to just throw out a diagnosis either and just say you have PTSD without, doing a little bit more work and more investigation to kind of see what's going on. So that's the whole purpose of the comprehensive evaluation, and it's going to take place over the course of our next few sessions that we meet. I think you're doing great so far. You're very
thanks.
cooperative.
I
And
try.
you seem very eager to kind of learn and work through this. So I commend you for that as well. you mentioned that you have never had been hospitalized before for anything, or have you?
No, no, not hospitalized actually. I managed to be just fine. I've had, stitches here and there, sprained wrist, um, broken ankle, little things.
Okay.
Nothing crazy.
Okay. Those came from playing sports when you were in college.
Yeah, some of them, and then a few injuries while I was in the military. But again, it was usually nothing major. Someone slamming my hand in a door or something dumb.
By accident?
Yeah, yeah, or out in the desert, those windstorms, they'll come in and just knock things over. And I had a hatch fall, which is how I messed up my wrist, and minor things, some stitches here and there, nothing crazy.
Okay. You were treated for those?
Yeah.
Okay. Are you single?
Yes.
Okay. How long have you been single?
I mean, I've been in a relationship, nothing too long. I'd say my longest relationship was probably 3 years. I feel like my interests and my career choice and has always, kind of pushed a relationship to the back burner. Yeah, because like that 3 year relationship, he started talking about the future, and I was like, well, I want to do this, I want to go here, and he's like, kids in a white picket fence. So I was like, not me, buddy. So that's kind of where that ended. I just don't want to feel tied down, really.
Okay.
But if someone's up for an adventure with me, I wouldn't mind. But the relationship's always been in the back burner for me.
How long ago was that relationship?
It was before, we broke up right when I left for the Army, so it was like 5-6 years ago. Yeah.
So it's been 5 years since you've dated?
No, I've dated here and there, but it was never anything serious. In the Army, you're always moving around, you're always finding new people. You can't really travel with the same people. So it's hard to maintain a relationship through all of that. So I've had little relationships here and there, nothing serious. Because we knew it couldn't go anywhere. It was going to be off somewhere else next week or next month. And it's just not possible to have a relationship while in the military.
You did 4 years in the military. Some people decide to make it a career. What made you decide against that?
I mean, I was just, I worked so hard, and all they did was work me harder instead of helping me to build my career and to, kind of help take care of me. I just felt like I was being used, and I know a lot of the soldiers felt this way too. We were just, we're just pawns in their game, and we do as we're told, and they don't really care about helping us progress or learn new things. Or
you feel they didn't have your best interests at heart.
Yes, exactly.
That they just wanted to use you for their benefit, but they really weren't concerned about your development, your career development, and what you wanted.
Exactly.
Okay.
And I still wanted to study psychology, which you can't really do anything as a psychologist unless you have a PhD for the Army anyway. So I was like, well, I know I want to go back to school, and I'm not going to waste any more time here if they're not going to help me out. So I decided I just need to get out before it's too late.
Were you discharged honorably?
Yeah.
Okay. So they're helping pay for your schooling, right?
Yeah.
That's great.
I know.
Yeah.
Otherwise, I wouldn't be able to afford it.
Have you thought about, when you finish and get your doctorate, thought about going back to the military to serve as a psychologist?
Yeah. Either work for the VA or maybe sign up, depending on the political climate. Wow. I definitely want to give back.
Wow. So outstanding. Okay. Well, I think that is it for the first part of this evaluation, this intake. Before we end, I kind of want to get an idea of some of the goals that you want to work on in therapy. I know the flashbacks are just at the top of the list because that is the most pressing issue that you came in with. But anything else? Anything else that you would like to gain?
Well, I guess I just have this idea that since I'm having these flashbacks, maybe I'm not as healthy as I think I am, or maybe there's something else I could be doing to kind of maintain my mental health. I just want to, get to a happy place. I don't know. I'm just obsessed with this idea that since I'm having these flashbacks, something's wrong. Something's really wrong in my head or in my body. I don't know, but I want to fix it.
Yeah.
And I want to be better and feel better and not be paranoid. I'm going to see something on the corner of my eye at any moment.
Right. Well, it's good that you came in now, and not wait till later. Because the thing with PTSD, that if it goes unchecked, it gets progressively worse and worse and worse. So it's good that you decided to come in and take care of your health right away, and not wait till try to struggle throughout college or through your PhD program and it get worse. So that's great. There's one more thing that I wanted to mention. Would you be open to the idea of group therapy?
Yeah, I mean, I just don't know, maybe later on, because right now I don't really know what's going on. I don't know how to talk about what's going on. I mean, I do love, I'm always a pretty open person, even to strangers. I like, going out and being with random people and talking and learning new things about new people and where they're from and stuff. But I just don't know, because I'm so unsure and nervous about what's going on with me that I feel like I'm worried that I'll just kind of do that blank thing again and just kind of not be there and just kind of be a blob in the group. And I don't like that. That's not me. So
you want to just make sure that this is what it is first, right?
Yeah. Okay. Kind of get a better idea so I can really engage in a group.
You said that your last medical evaluation was when you got out of the military or right before you left the military, right?
Yeah.
And it came back normal. There was nothing.
Yeah, I mean, it's military. They don't really try that hard. But yeah, it's just basically you fill out this form stating any complaints you have, and then the doctor goes over it, and that's your exit exam. But since then, I've gone to the VA, and I've had, I don't really know what they did, but they took some blood, and they said all my labs were normal. So I don't know.
Well, that's a good thing.
Yeah.
Your lab work came back normal, fine.
Yeah, and I haven't really had any, issues except for the migraines and now all this crazy stuff. So.
So we need to find out that it is PTSD. What do you think about the diagnosis?
Well, the good thing is it's very treatable. It's definitely something that's very manageable, and I can go back to a fairly normal life. It's not like my sister's diagnosis where she's, that's kind of we had to make lifestyle changes for her, and that's something that, changes you forever. I feel like this is something I can manage and lead a normal life. My sister's going to be with my parents the rest of her life, so it's a big difference. I actually don't mind that the diagnosis of PTSD so much because one, it puts a name to what's going on.
Yeah.
And I know it's treatable and I know how to treat it, and
that's great. Yeah. So that you're kind of more open to the idea of the having, knowing what it is and being able to fix it, to get help with it.
Yeah.
Okay. Well, that's what we're here for.
Yeah.
And moving forward, we're definitely gonna do some more kind of evaluation to see what's going on. But for the purpose of our first session, I'm pretty much done. We're pretty much done. If you have any questions at this point?
No.
Okay. So I'll go ahead and end the recording, and thank you again